Asthma and You, a comprehensive guide to asthma care and management for the high school student. It is important to remember you are not alone. Asthma affects approximately 300 million people worldwide. It affects approximately 6.7 individuals under the age of 18 in the U.S. alone. It can present at any age with a peak age at 3 years. Many people become asymptomatic by adolescence. Let us talk about the pathophysiology of asthma. Pathophysiology simply means the why, the how of asthma. It is important to remember that asthma is chronic inflammatory disorder of the airways. The inflammation contributes to airway hyperresponsiveness, airflow limitation, and respiratory symptoms. Now, let us watch a quick illustration of what it means to have asthma or an asthma attack.
A normal airway has bands of smooth muscle around the outside, a healthy pink lining on the inside, with a thin layer of mucus that helps to protect the airway. The thin layer of mucus in the airway creates a slippery environment to clear away foreign particles and irritants. Air is easily able to travel through the airway passage. People with asthma have sensitive airways. They react to triggers, which may cause their asthma to flare up. If a sensitive airway reacts to a trigger, changes can take place that narrow the airway opening. The airway becomes inflamed. The walls of the airway become red and swollen. The airway may also produce excess mucus. This causes the airway to narrow further, reducing the space inside the airway through which air can travel. The muscle bands around the airway may also tighten, reducing the size of the airway even further. Any one of these three changes that occur with an asthma attack, airway inflammation, excess mucus production, and muscle tightening, can make it difficult to move air both into and out of the lungs. A person with one or more of these changes in their airways may experience the signs and symptoms of asthma.
As we were shown in the video, the signs and symptoms of asthma include shortness of breath, wheezing, chest tightness, and coughing. Please remember, asthma is a chronic condition. It doesn't just go away. You will have periods of good and bad. Many people, especially teenagers, stop taking their medication when they are symptom-free. This is a bad idea. So if you're not supposed to stop your medication when you're symptom-free, how do we manage asthma as a condition? Let's talk about prevention. It is important that you avoid asthma triggers. As young adults, you should already know what triggers your asthma. Some common things are tobacco smoke, pollen, excessive dust or dust mites, roaches, cold air, mold, and animal dander or fur. It is also very important that you know your treatment plan. At your age, you are beginning to think about managing the condition without the help of your parents. You should know which medications you take, what they are for, and when to take those medications. Please consult a healthcare professional if you are unsure about any of these things. Also, know when to pre-medicate. Pre-medication may or may not be a part of your current regimen, but you can talk to your doctor about pre-medicating your asthma condition if you know you are going to be exposed to your triggers. Monitoring. As always, with any condition, regular visits with a healthcare provider are extremely important. At those visits, they will talk to you about medication, they will talk to you about your triggers, and they will talk to you about responsiveness of that medication. One of the most common ways we can tell how you're doing with your asthma is by measuring peak flows. A peak flow monitor is a small device that has a tube attached. You blow into this tube, and your doctor can determine your best flow rate. Once we determine your best flow rate, we will come up with an asthma action plan. If you have asthma, by high school, you should have seen your asthma action plan and know it well. The asthma action plan consists of 3 levels: the green zone, the yellow zone, and the red zone, with green being you're just fine, and red being seek medical attention. Commonly utilized treatment plans include bronchodilators. These are your asthma inhalers. Steroids. Steroids are pills, or they can be aerosolized medications that often reduce inflammation. Last but not least, anti-inflammatories may be included in your treatment plan. These prevent or counteract swelling or inflammation. Asthma action plans. We talked briefly about the asthma action plan when we talked about treatment. At this point in your life, you may be carrying your inhaler in your backpack, your purse, or on you somewhere. This is great. This means that you have begun to take control of your condition and to manage it without the help of another adult. It is important you remember, however, that the nurse still needs to be involved in your treatment plan. If you have not already, please make sure you have an asthma action plan on file with your school and your school nurse. This is important so that when something bad happens, we are ready to act. Or if you're not feeling well, we can modify your treatment plan according to what your doctor has ordered. Asthma action plans are an important part of asthma care, and every student with asthma should make sure that they know their asthma action plan and that those responsible adults around them are aware of the asthma action plan. This plan also includes who to contact if we're unable to get any information from you yourself.